Michael Hamilton, Vice President of Analytics at Albany Medical Center. The clinical documentation improvement efforts are really important from a perspective of getting the clinical record complete and accurate for twofold. One, for patient care. We need to have that record that's accurate so that the continuum of care is always reflective of the current state, and then it also drives revenue. And so we want to make sure that we're optimizing and receiving the correct revenue. As far as challenges for clinical documentation improvement, a couple of our biggest challenges were the time-consuming manual processes and the disparate data that just doesn't like to play together. I think one of the most important things for people to realize around performance improvement analytics, it's really all about the collaboration. You have to have an engaged physician champion, but you also have to have a platform and data scientists and analysts that understand how to translate between the two. So a couple of the most significant results from our clinical documentation improvement efforts have been twofold. One, we've been able to really shrink the time-consuming, laborious effort that it used to take. So we went from a 4-week effort to an effort of days. So that's been huge. The other 50% relative improvement in coding performance, just from the ED alone. So as we think about the future for Albany Med, specifically around the clinical documentation improvement, it's the expansion from the inpatient to the practice. We're going to start bringing in the CPT codes so that we can expand from inpatient to outpatient, so that we can have accurate coding across the entire continuum.